Welcome to Montana Matters. We're joined by Malcolm Horn. She is the Director of Special Services for Rimrock, and we want to thank you for coming in today, Malcolm.
Thank you for having me.
Of course. So we're talking today about mental health and addiction, of course, something that a lot of people are suffering from out there. It not only affects those who are suffering from this, but families and friends and just an entire community. So Rimrock is really helping in this effort. We want to know, is addiction considered a mental illness?
Yes, addiction is a mental illness, and people think that they're separate. They think of, well, addiction, people have no willpower, they just make bad choices, whereas depression, anxiety, oh, okay, you can't really help that. But really, addiction is a mental health disorder. It's considered one by the American Psychiatric Association. And the other thing is, when we talk about people with an addiction, there's often what we call a co-occurring mental health disorder. So they have anxiety, depression, so it's not enough to just stop drinking or stop the drug use. You also have to then treat the mental health problem, otherwise the person's going to continue to relapse or struggle with the substance use.
Okay, so these two things really go hand in hand.
Right.
How would our society change for everyone if we maybe had comprehensive care for addiction and mental health here in the United States?
Oh, I think it would be a drastic change. I mean, anytime you look in the newspaper, I can guarantee you, you see a story where someone has gotten in trouble or there's been a crime or a problem, and you can almost always go, oh, they had, you know, a substance use problem or that was involved. So how much would that change? And we know that addiction and mental health affect the individual, but like you said, it's the family, it's the community. You know, as a taxpayer, you know, we often pay the consequence for people not getting help. And sometimes people can't get help because they can't access it, they can't afford it, their insurance doesn't cover it, and that's just sad.
Yeah, it really is. So what are some of the signs that people can look out for if they're worried that someone that they know may be suffering from addiction or mental health?
Sure. So looking at significant behavior changes, so their personality changes, maybe they used to be very responsible, now they're not. Maybe their mood has changed, they're becoming very depressed or very anxious. They no longer, the things that used to be a priority or that used to be important to them are no longer important to them. Those are all things to look at, and I want to make sure that families know too that they can get help. Sometimes families feel like it's the other person, it's the person with the mental illness or the addiction, but needing to recognize that you deserve to get help too. And you can get family therapy, you can get your own coping skills to help deal with the behaviors that you see with your loved one.
Okay, and then what is the process like when folks are referred to Rimrock? What should they expect?
So when people are referred, first we figure out what exactly do they need. And people think that treatment means you're there for 28 days. Well, maybe not. Maybe it's outpatient therapy. Maybe you need just an individual counselor. Maybe you need some specific coping skills. So there's a lot of different options. There's a full continuum of care, not just for the patient, but also for the family. So they just need to call in, and one of us will help them figure out what exactly do they need, and then how do we get that need met.
Okay, wonderful. So Rimrock helping with mental health and addiction, a lot of great things that you're able to do for people. You're really changing people's lives, which is a wonderful thing. We want to thank you so much, Malcolm, for coming in today. For more information on Rimrock, issues like mental health and addiction, we'd invite you to visit their website for more information. That's rimrock.org, or you can give them a phone call at 406-248-3175. Thanks so much for joining us.